big upper lobe veins. They've got reticulation out here. You might be able to find some curly lines. Not sure whether they got any curlies. I'm not sure it's clear enough to be able to see them. See how big the heart is?
Mm-hmm.
That would be a positive cardiothoracic ratio. Oh yeah, there's no question. That's probably pushing 60%. And then a very prominent left ventricle here, because this patient has congestive heart failure. That's why they've got venous hypertension. They've got, you know, reticular changes. This one's very similar to that first one over there. Very similar, except this one has a pleural effusion. You see this density right here?
Mm-hmm.
And then there's a hazy area below that, down toward the diaphragm. No silhouetting on the diaphragm. We may be getting a little silhouetting in here, a little hard to tell. This one, though, is very bright, isn't it?
Mm-hmm.
This is less dense down here. When we look on the lateral, you see there's a fusiform density here. Everybody see that?
Mm-hmm.
And then there's another one like this. See that? These are kind of two elongated fusiform shaped densities. Do we have a normal anatomical structure sitting there and sitting here in the lung?
It's the middle lobe.
Fissures, right? Fissures. Major, minor. How many layers of pleura make up those fissures?
2. Just visceral.
Just visceral. Remember, the only one that's got 4 is the zygos up here.
Okay.
You know, it's the only one that's got parietal in it. There's 2 layers of visceral pleura. The pleural effusion in this patient is accumulating between the layers of the fissures. So the fissures, which normally would be right up against each other like that, are being spread apart by the fluid like this. So it's what's called an interfissure effusion. Interfissure effusion. It's atypical. That's a subpulmonic or infrapulmonic atypical. And this is interfissure effusion, also atypical. And mostly this happens in patients that have congestive heart failure. And in congestive heart failure, you know, they start getting pleural effusion, and it also slows down their lymph absorption, and they start getting a pleural effusion. Why it happens between the fissures, though, is a mystery. But this looks like a mass, doesn't it? Mm-hmm. Looks like a mass. So this patient needs to have their heart meds adjusted, and they're probably on a diuretic, but not enough. And so they need to increase the diuretic, get the heart pumping more efficiently. This will get reabsorbed, and it'll all disappear. It'll be gone. So this thing, which looks like a tumor, vanishes. So it's called the vanishing tumor, or the phantom tumor of congestive heart failure. It's an atypical pleural effusion. It's just an interfissure effusion is what it is. Great example. Now, this patient here, which has a much better sized heart, you see that compared to here? Much better sized heart. Relatively, pretty much normal heart. Do we have big, prominent upper lobe veins there like we do here?
Yeah.
No, we don't actually. We really don't. But look at the density in here. See it here?
The whole lower half is...
Yeah, it doesn't go all the way up here, but it's a pretty good part of the medullary portion of the lung. EKG leads. This is the same patient. See, there's no big prominent upper lobe veins here. This is the same individual without the edema. And this is probably a heart attack, most likely. So what happens in a heart attack?
damage to the heart tissue.
The left ventricle's not getting enough blood. The muscle's not getting enough blood. Is that going to affect its ability to function properly?
Mm-hmm.
Yes. So the left ventricle is basically being failed because of lack of blood supply. And it happens very suddenly. The right one is still pumping away. So the right one's pushing blood. The left one can't push it as efficiently into the systemic circulation. So where's it going to back up?
Lungs.
Backs up in the lungs. And it does it very fast with a heart attack. And so the blood just starts backing up, pooling in the lungs. The blood pressure on the venous side goes up and starts pushing more plasma fluid into the interstitium. Remember, it's capillary, interstitium, airspace. That's why interstitial edema is first. airspace edema is second. But it happens in the same area of the lung. It happens in the medullary part of the lung. This is interstitial edema. That one over there is interstitial edema. And they get the spider web in the medullary part of the lung. This one is past the spider web. This one is going into airspace edema, but this is not a full butterfly shadow yet. But it's getting there. And this may have happened just in a matter of 30, 40 minutes. That's one of the reasons they have such a hard time breathing when they have a heart attack. That's one of the reasons. Okay? And lastly,